For 4 months now, deputies in Oakland County have been armed with a powerful weapon in the fight against opiate overdoses.
We're talking about Narcan here, and it just saved a 6th life this week. A young woman just 21 years old who likely would have died without that antidote. And joining us right now is our chief health editor, Dr. Nandi, with one woman's way to battle opiate abuse. Tell us about it.
Yeah, great story. This is an important problem. You know, it's an epidemic around Metro Detroit. Heroin and prescription painkillers like OxyContin and Vicodin. Jeannie Richards, president of Brian's Hope, is working hard to save lives after losing her son Brian at the age of 26 to a heroin overdose.
I had 18 months before he would lose his battle. And in that 18 months, it was just horrible what we went through, our family, and now I've learned other families go through it too. And there's not a lot of resources for families, let alone for the addicts themselves.
The organization was recently awarded a grant by pharmaceutical company Calio for 200 kits, each containing 2 injections of Narcan. This summer, Brian's Hope plans to hand out these life-saving kits at 8 training sessions. They'll be held once a week during the months of July and August. The dates will be posted on their website, and the first 25 people to RSVP for each event will receive a kit, which means the world for a family who knows a loved one struggling with addiction.
By no means is it a magic bullet to cure the addiction, not at all. All it merely does is bring the person back from death. And it's a step, hopefully, to getting them into treatment.
For information on Brian's Hope and those kits and training sessions, head to WXYZ.com/Dr. Nandi.
So that's how it works, doctor. We heard her say it brings you back from death. Is it safe for everyone?
You know, I think this is important, that training needs to be done, because there are side effects. There are heart side effects, even coma and death, seizures. So the bottom line is that I think this can be life-saving. People should get it, but we should be adequately trained. If you're not adequately trained, it can really result in some problems.
But the average person can do it. You don't have to be in the medical profession to do it.
Absolutely, but just make sure you get a training session that's adequate for you.
All right, thanks so much, Dr. Nandi.
Thank you, I appreciate it.
All right, and if you have a question or a health concern for the doctor, you can email him at drnandi@WXYZ.com or send it to us on Facebook or Twitter. Next on